So welcome to Georgetown University, Lombardi's Comprehensive Cancer Center here in Washington, D.C., and I'm joined by my fabulous members of my fabulous team, our fabulous team in GI cancer. First, let me introduce Monica Chacha, who's focused in GI cancer nursing. So welcome.
Thanks.
And Dr. Mohammed Salem, who is one of our new partners here, who's made such an amazing contribution to cancer care and GI cancer patients in general. So thanks, Mohammed. I just want to give you guys a sense of what the cancer care team is like. And so, you know, cancer is a really common disease, and in almost every community nearby there is a cancer center, a so-called comprehensive cancer center. And what this really means is it's a team sport. It has all the elements that you need as a colon cancer patient to be cared for. And let's talk a little bit about all of those key elements. So Monica, you know, tell us about some of the important key pieces that have to be there to do the best job to take care of our patients.
Sure. So we have, we have a great team, a lot of people that work together. So we have the nurses in clinic who are kind of the go-to people. We have the infusion nurses who are going to give, people their treatments. They do a lot of education. They also do some symptom management. We have nutritionists, which are excellent, helping you kind of eat while you're feeling sick or while you're on treatment to maintain your strength. And then we have social workers that help with the whole array of different things.
And those folks are not there all the time, but they're there at the critical times to help guide and manage. So on the doctor's side, what's the team?
Sure. No, I think it's new to patients. So anybody come with cancer never had that experience before. At least most of our patients. So we have to walk them step by step. What if you bomb me? What cancer mean to them? How is it going to impact their life? So there is, at least in the beginning, there is a lot of discussion take place in terms of make them understand the diagnosis, what they have, and also introduce the team member, like the nurse navigator, the clinic nurse, the dietitian, the other subspecialty.
But almost all these patients have seen a surgeon by the time they come to see us. They've seen interventional radiology, the folks who put in Metaports and do biopsies, and gastroenterology and radiation oncology. So all of those folks are needed to put together our team. And we're just very proud of the team that we have here, seeing almost 1,000 new GI cancer cases every year. And I know or hope that we're providing our community as well with the kind of support that they need when they need this kind of expertise. So we partner very tightly with our community physicians and to provide the most patients with the best care we can. So if you're watching this, you're either a patient with metastatic colon cancer or maybe a caregiver or a loved one of a patient with metastatic colon cancer. And we're sorry you're part of our club, but welcome to the club. And we know that we've made progress with this disease. We have new medicines, many of which you may have already seen. When I started a long time ago, we really didn't have very many medicines for the treatment of metastatic colon cancer, and patients did not live very long. And now, with our new medicines and our better understanding of how to use them, we're hoping that you and others like you are living significantly longer. Not long enough, we get that totally. We have work to do going forward, but we have made progress. But the balance here is that you've got to been coming in every couple of weeks for chemotherapy. Sometimes you take a pump home, sometimes there are pills, there's side effects. And so very important for all of us in this marathon race that is metastatic colon cancer is to make sure you keep running. You need to be well enough. You need to feel okay. We need to watch your quality of life. We need to manage your symptoms and side effects and the pain and all the junk that comes with treatment for metastatic colon cancer. Now, most have gone through an initial line of therapy, maybe with a drug called oxaliplatin, another line of therapy with a drug called irinotecan, but there are two new medicines that work. They're oral medicines. One is called Stivarga, one is called Lonsurf, and they are different, but they both bring benefit to patients with metastatic colorectal cancer. And so it's kind of a shift in thinking. These are new chess pieces on the board, if you will, new laps in the marathon. And so your physician will be approaching you and talking to you about these medicines. And what we're really trying to do here is give you some information about these new medicines, how to manage the side effects, how to optimize your quality of life, how to optimize your energy as you continue on in the marathon race that is metastatic colon cancer.